Hey, I'm Annette Blacklock, sports podiatrist, and I'm going to help you with a 5-minute foot function program that is going to see the improvement of your foot function, your stability, and your strength all the way through from your foundation up through the kinetic chain. So, first of all, we have our release protocol, then we have our alignment, and then we want to think about how we stabilize a good postural alignment of our foot, and then we can go into strengthening. So of course, it'd be silly to strengthen something in a really poor alignment. So we need to unlock and release that area. So this is the principles of the Blacklock method, where we look at release, align, stabilize, and strengthen. So to release the fascia of the foot, we can use a trigger point ball. You want to roll the bottom of your foot, find any areas where you might have some knots. Okay, it might be a little bit tender, not too much. You place downward pressure over that ball and you flex and extend the toes. Take it to other areas where you find maybe some restriction in the tissue, bend and extend at the toes. Continue to always keep your breath moving into your diaphragm and your belly so that your nervous system calms down and you're not actually tightening up that tissue and restricting yourself from opening up the tissue. Place your heel down and the ball at your forefoot and roll from side to side to open up the front arch of the foot. And then you want to come down to touch your toes and feel into that difference from right to left side. You should feel that the foot is opened up, which opens up the fascia on the back of the calf as well. Opposite side, roll out, find any restrictions or areas of a little bit of tenderness, place downward pressure there, flex and extend the toes, and breathe into your belly. Place the heel down and open up the front arch of the foot. Once we've finished there, you're grabbing your roller, you're sitting down, and we're going to work on the calves. Okay, and all the attachments from the foot that run up into our calf. So you're placing it at the Achilles, your hips are down, you're crossing one leg over the other. Just take the feet from side to side, just like your windscreen wipers, side to side as far as you can go. So medial side to lateral side. Stay on the medial side and do some circles at the ankle, and go to the lateral side and do some circles at the ankle. You're going to bring that roller up to the middle of your calf and again side to side. Try and make sure you are continuing with your belly breaths, and if there are any of those restrictions, just try and soften the body, soften the breath, and take your time to release those restrictions. We always want to hydrate as well after we do fascial release to bring back new water and more hydration into the tissue. Take it to the top of the calf and side to side windscreen wipers. Take it to the medial side, circle, and lateral side, circle. So you can spend anywhere between 30 seconds and 1 minute doing these exercises. Just try and be consistent and make sure you hydrate the tissues afterwards. Circle and circle. Good. Windscreen wipers, side to side. Belly breaths. Circle. Good, and circle. And top of the calf, hitting all spots on the calf, because a lot of the attachments, as I said, from the foot come all the way up and attach into our calf muscles. Good, so once we've released the tissues, okay, with our myofascial release, we want to mobilize our ankle joint and our big toe. Okay, so just bringing the ankle over, you want to bring it into a dorsiflexion and a plantar flex position. I'm going to push down at the talus. Okay, this little square bone here, below these ankles, these ankle bones, the malleolus, just below that, push down with 2 fingers and bring your toes up. So we're going into dorsiflexion of that ankle and down. Do this about 10 times, and we're just pushing that bone back into its correct position, and it's really going to help the ankle move and slide more efficiently. From here, we're taking the big toe, grasping just below the joint, opening up the joint and taking the big toe up and down. Now, if this toe can't press down and push into the ground when we're walking forward, This big toe and those flexors speak directly to our deep core and our hip stabilizers. So we need good range and quality of motion of the big toe. So this is how we open up that joint space and keep it moving and gliding efficiently. Okay, so once we do about 10 reps of that, opposite side, pushing down into the talus, dorsiflex at the ankle for 10 reps. Coming into our big toe mobilization, grasping both ends around the joint, opening up the joint space and taking it through dorsiflexion and plantarflexion. So now we have that mobility through the feet. We've unlocked any restrictions. You'll feel you can squat a little bit better. You can reach for the toes a little bit more easily. So secondly, we want to look at alignment. Now the posture of your spine is important, but the posture of your feet is extremely important to have a nice steady foundation to stack all the joints on top of. So alignment of our foot is known as foot tripod position. The foot tripod position is the center of the heel, the base of the first toe, and the base of the fifth toe. So feel into it on one foot. What does it feel like as we shift our hips and our head over the tripod position? Okay, so as we shift our body weight over the tripod, you'll notice that your toes start to press down, or they should, especially that big toe, because it tells your hips or your deep core, stabilize, we're about to go into that single leg position when we walk. So it's natural that the toes go ready to push down because my heel's gonna start to lift off, okay? And the arch of the foot should start to engage. So shifting forward and back on one foot, find that foot tripod on both feet, find where you're steady over that foot tripod and the toes slightly press down. Start to link that with your pelvic floor lifting up and your body feeling nice and stable. Once you've hit that stable point, right, we've found that alignment, we now start to work on the strength of that stability. So single leg. Can we hold a nice, steady, balanced position on one leg? Toes slightly pressed down, arch of the foot is lifted, we're on that foot tripod. Now, I can start to move around that stable point. 1, 2, 3, 4. Notice my hip and my foot are stable, okay? 1, I bend the knee, I'm loading this leg, working on stability. Good. 4. Again, balance, knee up to chest. So we want to move around this stable position, and I'll show you from the side. A lot of times knee will come to chest, people will feel unstable, lean back. I really want you to keep foot tripod, engage the glute, lift here, okay? Not back, here. Stable hip. Open it out to the side, bring it to a quad stretch, and bring it to a figure 4 stretch. You can take out a little bit of sensory awareness. Other side. And maybe both. Make sure there's nothing that you can fall on around you, okay? Other side, same deal. Find your tripod position, shift your body weight over that tripod, and notice that you're there. You can swing the other leg forcefully and you'll know you're on your tripod and you're stable because nothing's going to get you off balance. The toes are splayed, the arch is lifted, the pelvis is in alignment. So we can go 1, 2, 3, 4. 1, 2, 3, and 4. Using the stability of the hip and integrating it with your foot. Go as far as you possibly can. Hug that knee up to chest. Again, lock out that hip, bring it out. Bring it back. And bring it over. Good. So now we've got good stability. Let's work on a little bit of strength with some calf raises, but we're going to do these properly. So a lot of times people will do their calf raises, but their feet aren't in alignment. We want that toe splay, and we want to really feel that we're pushing the tips of the toes down rather than just rolling onto the balls of the feet. So I want you to feel that you're lengthening the toes, pushing them down, and from that point your heel lightly lifts off the ground. So it's not a lockout, it's a lean, lift the heels lightly. Try and hold that position. Try and link it up with a stable core. So when you start to squeeze your glutes in this position and keep your big toe pushing down. Squeeze the glutes, push the big toe down, and connect the toes to the hips. Slowly lower those heels. You're gonna walk on your heels now. Walk on those toes again. So we're warming up the feet all the way up through to the calf, all those attachments. Walking on the sides of the feet to the pinky toe. You can even take these backwards, so training the nervous system. And walking on the inside border of the foot to the big toe. Now you want to make sure your knees aren't caving in here. It's that ankle mobility and strength that you have at the ankle to actually take you through from your heel to your big toe. Good, so that's your 5-minute foot rehab where we've looked at unlocking restrictions, mobilizing the joints, finding good foot posture, stabilizing that posture, and then strengthening the foot and ankle. So keep working on your 5-minute foot reset, and we'll see you next time.